the North West Norfolk MP, who we know has been campaigning for better dental provision in his constituency. Good morning, thanks for joining us.
Morning, Chris.
I know this is something you've talked about a lot, so you must be pleased to have got these two new contracts, particularly in Kings Lynn. Can you just describe what they will be? Are we talking about a new dental practice, or are we talking about more money for dentists in existing practices?
Yeah, no, this is very good news. It's probably alongside the QEH campaign, the issue I've been on Radio Norfolk most frequently talking about, so it's welcome news. So this is two new contracts. They're with a company called SmileCare Norfolk to provide a lot more appointments in Norfolk. As I understand it from the NHS, this could result in two new premises being delivered in Kings Lynn. And the contracts are for 22,000 units of dental activity. What that means is 1 unit of dental activity is an examination. A filling would be 3 units of dental activity. So that is a lot of new capacity that's going to be coming into West Norfolk, which is very welcome news because this has been a long-running issue for people. It's been a big issue in my mailbag, and that's why I've been campaigning on it for the last 2 years.
So you are confident that those listeners this morning who haven't been able to get NHS dental treatment in Kings Lynn will stand a better chance to do so after July?
Yeah, from the 1st of July, that's when this new service is expected to be in place. There'll be an increase in access to local dentist provision. The contracts, when they were let, the aim was for them to be operating from sort of 8 till 8 p.m. And more out-of-hours surgery times as well. So people should see an improvement from July, which is long overdue.
What about the situation in Thetford and Fakenham? I mentioned there that there were contracts up for grabs that nobody has come forward for, that there are no takers. That shows how big a problem this still is, doesn't it?
Yes, I'm obviously pleased that Kings Lynn's been successful with the two contracts that were put out for procurement. I was speaking to my colleague Jerome Mayhew about the issues in Fakenham. He's disappointed that hasn't been successful. The funding is there, and now the NHS really need to renew their efforts to attract someone to come to Fakenham as well, and as well as in Thetford. But it just underlines the challenges that there are in getting dentists across Norfolk and other parts of the country. We have the fewest number of dentists per population, the highest percentage of people unable to get appointments. So it's good news for Kings Lynn, but the NHS really need to focus on Fakenham and Thetford as well to try and make sure that there's new provision there as well, because it's needed across the county.
Yeah, as you mentioned, we've talked about this before, and one of the issues that comes up a lot is what actually is in the NHS contract, and will this problem actually be solved once and for all, and without that contract being ripped up and redrawn and started again with?
Well, exactly. The contract is a big issue. There's a debate in Parliament later this week where that issue will be raised by my colleague Peter Aldous as well, and I'm hoping to speak in that debate, because we need to get to a position where it's more attractive for people to do NHS work. Some of the issues with the current contract drive perverse incentives in terms of the way it's structured. So the government's been talking to the dental sector for some time about those issues, and I'd like to see some movement on that so that we move to more of a prevention approach and away from some of the issues that we currently have. We also need to look at training, and I want to see more people when people come to Norfolk, they tend to stay, but it's getting them there in the first place. So if we can do more training in the county, then that will also help get more people to come into the sector, so we have more dentistry available.
I think you've hit on one of the issues there, haven't you? This isn't actually just a Norfolk problem. I know you've campaigned for Kings Lynn and West Norfolk, but actually, lots of the rest of the country are finding the same issue. That's why this Toothless campaign group has got different branches all around the country. So that makes it more challenging for places like Fakenham and Thetford, doesn't it? It's not just them; they are almost going into battle and challenging the rest of the country for the dentists that are available.
Yeah, I speak to my colleagues in Blackpool. I speak to my colleagues down in Cornwall. We're all facing similar issues. So we need to increase the pipeline of people who are coming through training. We may need to look at what the incentives are after people qualify in terms of perhaps requiring them to do more NHS work in certain parts of the country where there's a undersupply. But I think Norfolk's obviously a great place to live and work, and we need to do more as well to sell the benefits of coming to Norfolk. But this is good news for people in Kings Lynn and West Norfolk. It's two new big contracts that have been successfully let after a lot of time where there's been a lack of provision, and we had the closure of my dentist in Lynn last year. We also need to make sure this activity is delivered. One of the problems that we faced in Lynn previously was only 65% of contracted activity, the contracts with dentists, was delivered. So that was a significant underperformance. So with these contracts, I understand there's minimum performance levels that have to be met for the contract, and that will make sure that people get more appointments.
You did mention at the start of this interview, you often talk to us a lot about the Queen Elizabeth Hospital. It just so happens our next piece with Jill Bennett is going to be about the huge crane that's lifting the new endoscopy unit into place. £12.5 million that's cost. When do you expect us to hear any more on how successful that campaign has been to get a new hospital or rebuilding work, extensive rebuilding work at the Queen Elizabeth?
Well, it's very exciting that the crane's there and the endoscopy unit is taking shape, and we've got a new eye clinic coming as well, with many more appointments for people, as well as the new outpatient unit. So that's around £30 million of investment that's coming into QEH this year. I'm expecting the announcement on the shortlisting for the next phase of new hospitals very soon. I spoke to the Health Minister at Argo the other day. He said it's coming very shortly. So hopeful of QEH will get through to the next phase, and then we'll continue the campaign to make sure we are one of the 8 that are finally selected.
You feeling optimistic?
Yeah, I think we've got a very strong case. So I had a positive meeting with the Health Secretary along with my colleagues Duncan Baker and Jerome Mayhew a few weeks ago. He was encouraging about the quality of the bid that the Trust had put forward. The regional NHS is backing QEH as their number one bid, so that's all positive. But we wait and see the shortlist, which I hope to see in the coming days.
Thanks for joining us this morning, North West Norfolk MP James Wild.